Good afternoon, everyone. My name is Charles Brooks, and today I will be giving you a presentation on the research and design methods concerning post-traumatic stress disorder effects on war veterans. As we all know, post-traumatic stress disorder, better known as PTSD, is a frequently stigmatized and misinterpreted psychological health condition that influences the lives of not only that particular veteran, but friends, family members, and people around them. Um, it transforms them, alters their lifestyle, and it's very stressful and frustrating. 10 known facts regarding PTSD. Women are at higher risk of developing PTSD than a man. Uh, it's something that you just can't simply get over. It has to be treated. It's somewhat of a soul disease. Therapy may be all that the individual actually needs to deal with PTSD. Uh, there are certain exercises that help manage PTSD. People have different tolerances for the trauma that they were exposed to. Therefore, levels of the disorder among individuals will be a lot different. And more and more people are continuing to develop PTSD as a result of experiencing extreme trauma. That all leads me to my research topic question: how beneficial is the treatment and medication being utilized to treat combat veterans with PTSD as they seek to live normal lives minus the challenges and impacts that this disorder presents to them? So the question, the importance of PTSD research. This picture exemplifies how important this research is to families across the country. Here you have an individual who's returning home from a deployment with his family. Everyone is happy. And then the picture opposite that, maybe 3 months, 6 months, a year or 2 years after that, and this is generally the scene. And this could be due to experiencing symptoms of PTSD. The literature review that I utilize before you basically was mostly quantitative. Um, it was minimum qualitative involved, but it was quantitative research approaches utilized, and then it was actually one defined mixed method uh, established throughout the entire review. Here are my two published research study evaluations um, that I went over prior to putting this presentation together. Um, the first one was a qualitative study, and the title of this study was Recovery from PTSD Symptoms, a qualitative study of attributions in survivors of war. And it basically was 100% qualitative, and it went into the different facets of how they went about conducting this research. And opposite that, we have my quantitative evaluation, which it was titled Reevaluating Disability Assessments in War Vets with PTSD. And it was the same premise. It was totally quantitative, uh, and it used all the measures, the techniques, the approaches, the strategies in order to uh, get get the best result as far as the research and data that was conducted from the test individuals. Here are the potential methods that could have been used in my main literature review. We have the explanatory sequential mixed method design, the participatory action research, the Solomon core group design, or the non-experimental survey approach. The appropriate approach and rationale that I came about was the mixed method explanatory sequential design. It basically laid out everything. It utilized both the qualitative and the quantitative methods. It was basically followed the sequential design, with the quantitative method being the baseline method for extracting data from each individual client. The eligible clients were predominantly English speaking, and they were over the age of 18. It also utilized the qualitative method, which provided a different additional information and allowed the researchers to dig a little deeper by the use of interviews, so they could really weigh heavy on the morals and the beliefs of each particular client or participant doing the research process. And right here we have the ethics layout. In terms of the ethics, it tended to follow the blueprint for informing the individuals of the type of research being done, the confidentiality guidelines, and it discussed the limitations of the confidentiality, and also informed them that would no physical harm come to them by participating in this. But one thing, if you look at 3.01 that I seen could have been deemed as unfair discrimination, was the fact that yes, they basically went with all English-speaking individuals over the age of 18. That could have been a oops in terms of some form of unfair discrimination. To sum up the research without diving too deep into it, we see this as it relates to our initial question about treatments that we were doing versus the things that we're trying to do, the involvement that we're trying to get around to doing now. If we continue to go down the path of the past treatments and keep doing the things the old way, it's only going to be good for a short term. It's like putting a Band-Aid on, and you're still going to have those adverse effects affecting those individuals, their family, and their loved ones. Whereas if we go with the intervention route from a social standpoint and getting communities involved, that way you can get the funding, you can get the bigger facilities, and you can get the research done. If all that plays out, you can get that long-term enduring care that's going to be more effective and more long-standing, and will allow these individuals to kind of like heal, over a long period of time, which would not only be good for the individual, but also be good for their families, and they may have the opportunity to live that normal life that they so much desire, which reverts right back to the initial question. Okay, in summary, we just kind of like touched on positive impacts, significant improvements, and how we can actually be innovative by using that psychosocial intervention to lead us toward positively affecting these individuals, and how to better facilitate them and treat them so they can be, normal to a certain degree and live that normal life. These are my references. And I'd like to thank you for your time. Again, my name is Charles Brooks.